it's critically important to heal the gastrointestinal tract in autistic children. Autistic children have forced us to learn more about the connections between the gastrointestinal tract and the brain. For me, this started with the first child I treated with bethanyl. He was a 9-year-old who was nonverbal. And after I did the research and realized that if acetylcholine was blocked in the gut, I tried to find something that was FDA approved for use in children and had been studied and used in small children. And there was a medicine called bethanyl or uricoline, which we used for reflux in infants in the 70s and 80s. It's kind of an old-fashioned medication, but that would help replace the acetylcholine that was blocked in the children. The first child I treated was a 9-year-old who was nonverbal, and I gave him a dose, and 55 minutes later, he woke up and carried on conversation with me, was reading, and talked to his mother. He stayed that way for about 2 hours and then went back into autism. But since that time, the gift that gave me was realizing that this is really represents disconnected language pathways in the children. And it also gave me insight into the connections between the gut and the brain. Since that time, over the last 8 years, many people have been researching these connections. But I have found consistently, if I take the first 3 months of treatment and help improve gastrointestinal function in the children, normalize the bacteria in the intestinal tract, heal the intestinal tract wall if there's inflammation, keep them away from foods and various things that cause inflammation in the gastrointestinal tract wall, the brain improves and their developmental progress, it can be remarkable.